I'm Betsy Andrews. I'm an associate veterinarian here at Pleasantburg Veterinary Clinic in Greenville, South Carolina. I'm going to talk to you a little bit about National Pet Dental Health Month, which is coming up in February, which is the end of this week. So I'm going to talk about why we do this every year, why it's so important for you to take care of your pet's teeth, and what can happen if they have dental disease that goes untreated. So not many people realize that by the age of 3, 80% of dogs and cats are affected by dental disease and periodontal disease. It is the most commonly diagnosed disease in dogs and cats, and there are ways to prevent it and there are ways to treat it. So that's kind of why we bring awareness to this during the month of February. So you may notice a foul odor coming from your pet's mouth when you go to give them a kiss, or if they come kiss you. And that's not just halitosis, that's not just bad breath, that's actually infection and disease at the gum line. And so if that does go untreated for a while, that can cause other issues in terms of that infection getting into the bloodstream. It can actually lead to heart disease, kidney disease, and even respiratory disease. You know, if they inhale some of that tartar and infection. Not only that, it can also be very painful for dogs. The head is connected to the rest of the body, and so if they have disease of the gum lines and of the teeth, that does end up affecting the rest of their body. They can show pain. I know how painful it is if I ever have a toothache, and pets can't tell us that, but you can only imagine how bad it would feel to have an infection at the root where those nerves are. And so we'll also see a lot of times dogs will have fractured teeth, and that can happen from chewing on things that are too hard. And so I tell people I would never let my dogs chew on hard bones or hooves or antlers, anything that doesn't have a give to it. You want it to be malleable and able for them to have a little give so that they won't fracture their teeth on those, because once a tooth becomes fractured, infection ends up getting into the root and the gum, into the bloodstream there, and then we end up having to extract that tooth. And so I'm just going to show you on Chi-Chi a way that you can look in your own pet's mouth if you're curious if your own pet has tartar or plaque buildup. And so Chi-Chi's a good patient because she's going to sit here nicely. So all you have to do is just lift the lip here, kind of look into the back of the mouth there. She does have quite a bit of tartar built up on this upper canine here and her back premolars, and you can see on this side as well. And she is starting to get some inflammation and redness along the gum line, and so she would be a dog that I would recommend a dental cleaning. And what that is we go and we actually scale and polish the teeth and get them back to their healthy state. If you are unsure whether or not your dog needs a dental cleaning, and if you're unable to look into the mouth at home, feel free to bring your dog or cat up here. Cats need dental cleanings too, and we'll take a look for you. And then if we do move forward with that, the scaling and polishing, get their teeth really clean back to a nice baseline, there are some ways to maintain that at home. The Veterinary Oral Health Council has released a list of products that they have approved for dog and cat dental health maintenance, and so you can look at those products at vohc.org. It'll have a list of water additives, gels and paste and dental treats, even dental diets to help maintain their oral health. But I hope that gives you some great information on why it's so important to keep your pet's teeth and mouth healthy, and ways to help do that at home, as well as in collaboration with us. So have a great week.